Starting today, the Ghana Physicians Association is withdrawing all emergency and out-of-patient department services in public hospitals. The industrial action is over what they describe as government's reluctance to address their poor working conditions. A statement to members directed them to observe the strike until government fixes the salary discrepancies, career progression, and other demands. So Roland Walker is at the Mamobi General Hospital. And he's going to tell us exactly what's happening, how this is impacting on the services there this morning. Roland, over to you now.
Well, thank you, Mama Viusabwaji, and thanks for the update as well. Indeed, the physician assistants, they're embarking on this strike action, and apparently started the whole of last week, or a better part of last week, at the General Hospital here at Mamobi. The superintendent, Dr. Afo, as well as her assistant, Dr. Salamatu Lawson, have tried as much as possible to make sure that they are in a position to stabilize medical care and treatment for various patients who come. And so when you come here, you have the information decks, everybody is ready, but it is basically the health services that seem to be affected. There is an HIV clinic that is expected today, so it's available. People can come. The doctors, they are doing that interaction because with the absence of the physician assistants who tend also to deputize the role of the medical doctors in various public hospitals across the country, it becomes a bit difficult because the medical doctors are few across all the spectrum of the public hospitals we have, and more so, they tend to be overwhelmed with a lot of work. So we're getting into the OPD, and that's the outpatient department. So you can vividly see that the number of patients have come. They want services rendered, that is just medical care.
Unfortunately, we've lost the link to Roland Walker. We're working on that. We are going to reconnect with him, and fortunately, he's back. So let's join Roland now.
So you find that the records department is working to make sure that they collect the data, and all this they are doing just laying in wait so that the few number of medical doctors or experts they have will come in as much as possible. I'll speak to a number of the patients and ask them how long they've been waiting, because that is the current case we have across the spectrum of public hospitals in our country. The patients, because of the absence of the medical assistants or the physician assistant, would have to wait for long hours before they get some treatment. And I would want to interact with some few patients who are willing to, and just speak to a number of them. Good morning to you, sir. How are you?
Fine.
What's your name?
Raphael.
Raphael. And just tend to the lens of my camera a bit, I think will be better. But generally, we know that physician assistants are on strike. They've been on strike through the latter part of last week till today. I spoke to the medical superintendent here, and she said that they've been trying to manage. But I just want to ask you how long you've been waiting.
For about 30 minutes now.
Okay, you just came for the last 30 minutes. And you're laying in queue, or you're just in the queue to make sure you get your records collected or well invented?
I'm waiting to get my... Actually, I have a new folder, so they are actually... I'm waiting to get my folder filled before I...
And also, there are a number of patients also who had been referred from last week who will come in, and so many of them are here also from the last week, but more so, well, we also need to get to the nitty-gritties and ask them how they're faring on many of the other fronts. The laboratory is working though, but they need more of the medical doctors to be in a position to attend to cases. Now, we, as much as possible, will try to get a vivid picture. Because of the issues at hand, some patients also have been a bit reluctant to get some treatment for the cases they would bring. So you can find that some of the seats have been empty because they've had hindsight, knowing that the treatment has not been forthcoming as quickly as they would want. The doctors have been inundated with a lot of cases, especially from the latter part of last week. So the pharmacy department and the other relevant departments are all available, and they would want to also serve. But with the absence of the speed in medical delivery, it becomes a bit of a difficulty. But that's the current situation that we have at the General Hospital at Mamobi. The laboratory has been extended to another side of the hospital. So let's try and see whether we can get to the laboratory and also get to know what the issues are, how they are coping generally as professionals, and how also they tend to attend to cases as and when they get them. You have the normal offices running, and sometimes it becomes a bit difficult trying to know who has to be given what treatment at what point. As much as possible, we also tend to have the information that the physician assistants then tend to play important roles in various aspects of medical consulting. So you have that, for example, we have the medical consulting rooms all available. We have the consulting room 1, and then you